Lupus is a mysterious illness. It's often misdiagnosed, but it affects about 1 million Americans every year. 13 WHAM's Jen Markham checked on some research that's being done in Rochester, research that is offering hope to some of those patients.
Lupus is a disease where your immune system starts reacting against yourself and causing inflammation when it shouldn't.
The disease can be difficult to diagnose because lupus can present different symptoms in different people.
You can have somebody who's anemic, you can have somebody who has joint pains, you can have somebody who has skin rashes, you can have somebody who has seizures, you can have somebody who has kidney problems. It's a very broad disease.
Because it isn't visible, people don't know what you're dealing with.
It took 6 years for Julie Merceau's chronic joint pain and fatigue to be diagnosed as lupus. 3 years ago, she enrolled in a clinical trial at the University of Rochester Medical Center and found relief with the treatment of the lymphoma drug rituximab.
Although I don't have a cure, I have a huge change in my quality of life.
The University of Rochester Medical Center is one of the leading lupus research facilities in the country. Not only do they hold the clinical trial for rituximab, but they're currently working on nearly a half dozen new drugs that should have fewer side effects.
There is not a cure for lupus, but there are some very good treatments. But there are still some patients where the drugs don't work, or the toxicity from the drugs is as bad as the disease. So, there is a big need to get better drugs, both in terms of effectiveness and in terms of less toxicity.
The drugs being developed by the University of Rochester are at various testing stages of development and won't be eligible for approval for several years. Jen Markham, 13 WHAM News.
The Lupus Clinic is hosting a Lupus Education Day tomorrow at the University of Rochester Medical Center. For more information on that, you can go to 13wham.com.